how should doctors talk? I mean, their pronunciation, their vocab. Well, everybody knows doctors are pretty well educated. They're right up there, aren't they? In terms of the use of language, they have a huge vocab, probably not as much as a university professor or a professor of English language or some intellectual, but it's up there. Now, but the fact is, when it comes to treating patients who may be an extremist, they're so sick they may feel they're going to die, or so severely injured they feel they're going to die, you can't use what we call posh. That's an English term for upper class language to talk to them. There's different ways of speaking, particularly in England, where it shows which class you belong to. The aristocracy or royalty, they're posh, so they use a language that is displayed to everybody else that they are, but in fact they may not have much education. The educated classes are educated, and then there's the other classes. They can use a type of language hard to understand. Now, what you should do is communicate in a very simple, direct way these very important concepts or information you have to get to the patient. But then again, don't use your language full of jargon. Hey, mate, all right, yeah? Because patients know you're a cut above them, and they want to know that you are a person of respect, of a certain standing in the community. And they don't really want you to be in a rough sort of way. Don't present yourself in a rough old sort of way. So in summary, how to communicate? Very simply, don't use jargon, use straightforward language, don't use posh or so-called upper class language. Hope that helps.